Hi, this week's video reflection will be about the assigned learning material for week 14, which includes mental health disorders and substance abuse disorders. I found this week's material really interesting. I really enjoyed doing the readings and listening to the videos that were assigned. Question 1 for this week was, what surprised you from the materials and what did not surprise you? So what surprised me when reading about the different mental disorders this week were some of the facts about schizophrenia. I was surprised to know that it affects men at a younger age and that most are diagnosed in their early 20s, while women are diagnosed in their late 20s. It's just surprising to me that you can make it through what feels like half of your adult life without having that diagnosis. That's a little bit scary to know that you can be almost 30 years old and still have not figured out that you have such a serious diagnosis like schizophrenia. What didn't surprise me were some of the statistics that were surrounding substance abuse. One of which was that in 2017, there were 70,237 deaths that occurred related to substance abuse. I believe that was involving opioids. So that didn't surprise me that much just because it's been such a huge problem that's been in the news and we've learned about it at work, and you can't turn on the news without hearing some of those statistics sometimes. So moving on to question 2, 3 facts about mental disorders that I learned this week. One is the changes in, One is the changes in the brain that happens to schizophrenic patients. That includes the reduced gray matter in the temporal lobes, an enlarged third and lateral ventricle, and then the excessive dopamine secretion that happens in the brain. There's also a decreased blood flow to the temporal lobes. And also that medications like chlorpromazine or thorazine are used to actually interfere with the dopamine that's overly being secreted. Another fact that I learned this week about mental disorders are some of the causes of depression. And that depression's caused by the decreased activity of neurotransmitters, so decreased serotonin and norepinephrine levels coming from the brain, and that there are genetic components. One fact that stayed with me was that if you have a family member that suffers from clinical depression, you're 3 times more likely to develop or to be diagnosed with clinical depression yourself. And then panic disorders also involve abnormalities of neurotransmitters. They also have an increased discharge of neurons in the temporal lobe, and there are lower levels of norepinephrine, serotonin, and then GABA, which is the gamma-aminobutyric acid. And panic disorders also have genetic components. They tend to run in families. Question 3, identify 3 things that you learned about substance abuse disorders. This I found very interesting, actually, that learning what happens to the brain when you drink alcohol and how it plays a huge part in alcoholism. The gamma-aminobutyric, I have a hard time with that word, the gamma-aminobutyric acid, or GABA, I'm going to call it GABA, acts as an off switch and restricts brain activity. So when you drink ethanol, it actually binds to the GABA receptors and inhibits that signal even more. So it really just shuts down your brain and your brain activity. Ethanol also activates the release of serotonin and dopamine, so you get that elevated mood sometimes from drinking alcohol, and that's what's happening in the brain when you are feeling kind of like relaxed and maybe a little bit more happy, a little bit more carefree. And what was interesting to me about that was that I often will talk to people about self-medicating and people who use drugs and alcohol to make themselves feel better because they may have an underlying anxiety disorder or depression disorder, or maybe post-traumatic stress disorder, and they don't want to go to the doctor, or maybe there are there are restrictions that, or I should say, barriers to them receiving medication or receiving a diagnosis of those things. So I have talked about self-medicating in my career, and now I understand what it actually means when people use alcohol to try to shut down their brain because they're overthinking things or maybe depressed or just having thoughts that they don't want to deal with. The alcohol literally shuts it down. So I thought that was really interesting. And then alcohol use disorder and its long-term health consequences. I have known about, obviously, the problems that alcohol can cause and the impact it can have on the rest of the body. But some of the things that stood out to me were dilated cardiomyopathy, the inflammatory changes in the liver, pancreatitis, all the different types of cancers that can develop because of overuse of alcohol or alcohol abuse. And that's mouth, throat, esophageal, liver, and breast are the more prominent cancers that can come from alcohol abuse. And then, of course, vitamin deficiencies. I have taken care of patients with Wernicke syndrome before, which is a thiamine deficiency that causes impaired memory. Substance use disorder. That's when a patient is using the use of drugs impairs any aspect of a patient's life. And the general indicators of substance abuse are changes in behavior or appearance, maybe changes in their personality or daily living habits, or work habits, work patterns. A person may become defensive or angry if you approach them about their substance use or alcohol use. So those were some of the things that I learned this week about substance abuse. And again, the most interesting to me was the effects that alcohol have on the brain. I'm most excited, I think, about this week's learning activities because my future practice will involve psychiatric and mental health. I plan on being a psychiatric and mental health nurse practitioner. And as much as I found relearning the pathophysiology this year or this semester on the graduate level, I really enjoyed going back and going over all the things that I thought I knew pretty well, but at times turns out I needed a pretty decent refresher. But other than that, I am very excited to start learning more about the brain and the psychiatric disorders. So I can use what I've learned this week in particular with my practice moving forward and really understand why patients are suffering from alcohol abuse, substance abuse because of chemical reactions and different levels of neurotransmitters that are going on in their brain. So learning all of this is really going to help me empathize with my patients and know how to help them in the future. So thank you very much.